Hi Sachin, thank you for joining me today to talk a little bit about the CAMHS Tier 4 Provider Collaborative for the East Midlands. For anybody watching, my name is Carla Renton. I work in the communications team for Northamptonshire Healthcare NHS Foundation Trust, which is the lead provider for the CAMHS Tier 4 Provider Collaborative. Sachin and I are going to have a bit of a chat today through just some more information about the Provider Collaborative. So hopefully we'll have answered all of your questions by the end of the video. Okay, Sachin?
Thank you.
Do you want to introduce yourself?
Right. I'm a child psychiatrist and I have been an inpatient psychiatrist in Northamptonshire since 2010. I have been doing child psychiatry since 2000 in Northamptonshire. And at present, I am the clinical lead for the Provider Collaborative for East Midlands in CAMHS. That is Child and Adolescent Mental Health Service for the East Midlands.
Great. Okay, thank you. So before we hear a little bit more about your role as the clinical director, could you explain what the Provider Collaborative is?
So the Provider Collaborative is a new way of working, and all the inpatient providers in East Midlands, there are other provider collaboratives dealing with other subjects in the East Midlands, but the Provider Collaborative that I lead is particularly concerned with inpatient services for child and adolescent mental health, and it covers all the trusts which are in the East Midlands. So starting from the north, we have Nottingham. Derbyshire has got two trusts, both North Derbyshire and South Derbyshire. We have Nottingham, Lincolnshire, Leicestershire, and Northamptonshire. Apart from that, we have two private providers, that is St Andrews and as well as Scone. So that is those are all the trusts which have come together to work together to improve the services for children in this area.
Great, thank you. That was really well remembered, that list of providers. I'm not sure I would have remembered all of them. Well done. And so, okay, so all of these organisations have come together then in this provider collaborative for, like you said, the CAMHS inpatient services. What is it that the provider collaborative aims to do?
Okay, so there are a few basic differences between how the provider collaborative works and how we used to work previously. So one of the first one is that the provider collaborative itself commissions itself. So Northamptonshire Healthcare Foundation Trust as the lead provider will be the commissioner, but the board for that has participation from all the collaborative, so we take on the responsibility, but we are commissioning ourselves. So that's the first one. And the aims are to have an equitable provision across the whole of the region and avoid these kind of postcode lotteries that may come up because of the various developmental needs. And in today's specializations, it's to ensure that everybody in the region gets an equal chance of getting into the hospital that they need. And whenever possible, it's to deliver care closer to home. Mm-hmm. And apart from that, we are going to be razor focused on avoiding unnecessary inpatient admissions, as well as avoiding delays to admission. So it's going to be a much more streamlined process. And as time goes by, the focus is going to be on delivering care at home, closer to home. So although we are inpatient providers, our aim is to kind of devolve more and more care so that the child can be looked after at home itself.
Okay, cool. What I'm hearing there is it sounds like we're working as a region rather than working as, independent providers doing their own
Yes,
thing, actually
yes,
all working together. And like you said, making sure that a child, whether they're in Northamptonshire or whether they're in Nottingham or Derbyshire or wherever in the region, gets that same care and that same level of service as anywhere else in the region. Yeah.
absolutely, absolutely. So two of the central pillars is going to be, single point of referral, so that all the referrals are processed centrally.
Yeah.
Second one is that there will be a single waiting list, so that once depending, so children are allocated places according to need, rather than just because you happen to have an affinity with that area for
Yeah.
whatever reason. Absolutely.
Great. So what's the plan? What's the kind of the plan or the roadmap to achieve what we want to achieve?
Okay, the first thing, I think, which is quite important to keep in mind is that this is a journey and we are starting on the journey together. And so it's a chance for all of us to work together. So a few things we have kind of started before we start. I mean, the provider collaborative comes into existence, if everything goes all right, on the 1st of April. But prior to that, we have been meeting with each other. We have set up the committees to look at what problems are being faced by us and how we can solve them. That's the first one. Second one is this word, which I think is going to become very familiar to it, which is called co-production,
Yeah.
which means that we will be, all the plans that we are creating are created in conjunction and in partnership with the service users. So, that changes the prism and the optics of looking at problems. So, what we'll be looking at is what is the, what is the patient's perspective? What makes life easier for patients, instead of looking at trust and individual clinicians' perspective, which has been something that has happened quite a lot in the past. So, yeah.
No, that's really exciting. I think the idea that actually, and it's a bit different, isn't it? Because I think when you work in health and care, you're quite used to seeing, right, this is the plan for transformation and this is how we're going to do it. So the idea that actually we've all come together and we all get to join in on creating what that looks like, whether you're staff working in the service or patients and service users and their families, is really exciting. And that should hopefully, like you said, mean that actually what we develop and what we create does deliver the outcomes that we need it to for the service users. So that sounds brilliant. And I think it's reassuring for people as well, that if they think that there's going to be a plan right now, there isn't, but that's not because we don't know what we're doing. It's because we're going on it all together. So how are you going to make sure that people have their opportunity to be involved? You mentioned we're going to do co-production and we're going to get people together. Is there anything planned at the moment? Are there any groups that people can join? How can they get their opinions heard?
Absolutely, absolutely. So, as if you are a clinician working in anywhere in the region, or have an, so you can write to me and write to us and join what we call the clinical reference group. And we also have some subcommittees. So we have a subcommittee which works on issues which are particular to children with learning disabilities and autism. We have another group that works with issues with eating disorder in children.
Mm-hmm.
There's a third group which is working on, children who find it difficult to be managed in usual hospitals. So they need what we call psychiatric intensive care or low secure hospitals, or who need specialist packages of care even when they are in the general, general adolescent unit or that. So that's the another group. So you could be, if your interest is in any of that, so you could either join the subgroup. So yeah, please write to me and I'm interested. And if you are either a service user or a parent of a service user, you can join our co-production group, which is kind of, which we have people from all over the region again. And at present, the group that is working with parents and both parents and young people are in the same group, but they will hold meetings both separately and together. So that's what they have decided. So that's what we'll be doing.
Great. And I'll make sure when we share this video, we will share all of the contact details so that anybody watching it who wants to get involved can contact you or get in touch, and we can make sure that they're involved in those groups. That's brilliant.
Yeah, thank you very much. And I want to emphasize that, one of the difference is that, we are the collaborative, all of us, the clinicians, the service users, all of us. So there's nobody separate from this.
Yeah.
So if you want to have your say, either, to come once and say, this is my experience, this is what I want to say, or really want to be part of the strategy planning, or to look at inspections or looking at complaints, there's a lot of roles that will open up as we take over, and it's going to be done together. So there will be place in also these areas moving forward.
Brilliant. Brilliant. That's so exciting. So many opportunities to get involved, isn't there?
Yes.
All right. So you mentioned about the 1st of April.
Yeah.
That's the go date.
Yeah.
So what if anything is going to change or feel different for either CAMHS staff or service users on the 1st of April?
Well, it's not going to be a road to Damascus moment, and there will be a flicker in the sun or anything like that. So I think, I'm hoping that what you will notice is that that things are working as well as they have in the past, and then there will be incremental improvements from that day onwards.
Yeah.
And outcomes will be better. So, and this is what I have been telling people, is that, this is not, we are not launching a revolution, but we are launching an evolution. So,
I like it. Yeah.
so, things will get better because people, and that's how it does happen. People work hard, people change things, and we can look at anything that we want to change, anything that we think is not working up to the mark, or even if it's good, how can we make it better? And we do whatever is required to make it better,
Yeah.
That's going to be our approach. Very often, we always get these miracle workers, and I don't believe in miracles. So yeah.
No, I think that's really reassuring, because sometimes when people know that transformation's happening, or there's some kind of pathway development happening, there is that worry, isn't there, that, like you said, a switch is going to flick and everything's going to be different all of a sudden. But no, it's not like that. Like we said, that key thing is it's a journey. We're just starting the journey, and there is going to be lots of improvement as we go along the way. But yeah, it's not all going to feel different, all on day one, is it? Okay. Right, so let's get back to you then. What is your role, the clinical director for the collaborative? What's that all about?
So I am responsible clinically for everything that happens. So in some way, you can say that as far as clinical care and treatment, those things are concerned, the buck will stop with me. So if there's any issues, you can directly contact me. I will try to support this. But I'm also, but what am I doing day to day? I'm trying to create pathways, helping people. So if somebody comes to me and says, and or the collaborative says to me, we need to look at this, we need to look at, any particular area, I try to then set up the mechanisms so that the people doing it, the people using it, actually have the say in how it needs to be changed and what needs to be done. So we have a wide array of experts that we bring to bear on it, and we can really make changes which are sustainable, which make differences to everybody. We are not ignoring anybody. So the change needs to be to work for patients in the first instance,
Yeah.
the clinicians who are caring for them, the trusts that are caring for these people. So yeah, it needs to work at all levels. So I'm kind of responsible for that.
Okay. Like you said, the buck stops with you.
Yeah.
Yeah. Okay, so to round off then, is there anything else that you want to say about the CAMHS Provider Collaborative, or anything that you want to say to CAMHS staff across the region, anybody interested in it at all?
So the first thing I'd like to say is, this is a really exciting path, and we are an inclusive body. So please come and join us. Please come and contribute. No contribution is too insignificant, and we are welcoming everybody. So it's not like if you say, oh, I would like to take part in something, you have to jump through hoops and be selected or anything like that.
Yeah,
As
yeah,
long as, so whatever group you belong to, if you're a clinician, if you're a service user, you can join those groups absolutely. And they hope, we want to make sure that these two groups join together to work to bring about improvement. So anybody who's interested, we want to say it's open to everybody who is interested in that. So that's the first thing.
mm-hmm.
And the second thing is, if you are unhappy with anything, please let us know. So it's not just, somebody who's saying good things or want to improve. So if you find a good thing or a bad thing, again, talk to us about it. And, if it's something that is not up to what you expected, we will kind of try to make it better. And even if your experience wasn't that good, we'll try to ensure that people who are using the service now or who will use the service to come will have a better experience.
Yeah,
And if your experience was good or exceptional, please let us know so that we can use that as an exemplar, and also kind of, send the message to those people who looked after you that they were extremely pleased about this. Yeah.
yeah. Brilliant. So it's really, really inclusive. Everybody's welcome. Like you said, we want to hear, from all your experiences, all your opinions, good, bad, indifferent,
Yeah.
whether you're a service user or a colleague. Yeah, just get involved. That'd be great. So like I said, we will share all of the information that everybody watching this needs in order to get involved. We'll share that along with the video. Comms wise, communications wise, we are going to start sort of sending some more things out, aren't we? I know that you guys are doing some Q&A roadshows for operational staff to be
Yeah.
involved in. So again, if people have still got questions after watching this video, then they should absolutely get themselves along to one of them. They can ask you questions, and you'll answer them. There's a panel, isn't there, going to be doing
Absolutely.
those. And we'll also start, as we go on this journey together, and as we start making improvements and implementing plans and implementing change, we will start communicating about that as well via communications leads. We've got a really good network of communications leads across the provider collaborative, and also the service managers as well. So I think basically my message to everybody on this as well is keep your eyes peeled, because we will be we'll be sending stuff out. And absolutely, if you've got questions that you're not seeing answered, get in touch with us, and and we'll do our best to answer them and to involve you in this journey that we're all going on together.
Absolutely.